Hello, everybody. I'm Nickie Aiken, the MP for
Hi.
the Cities of London and Westminster. And today I'm delighted to be joined by members of the local Bangladeshi community who are going to be talking to me today about COVID-19, how it's affected them, and the importance of taking the COVID-19 vaccine when it is offered. And I'm delighted to be joined by Shaista Mir, who is the chairman of the Westminster Bangladeshi Welfare Trust, Roxana Rashid, who I know as Roxy, who is a midwife and nurse, and Mohammed Janal, who is the chairman of the Westminster Bangladeshi Association. Thank you all for joining me today. Can I first start, Shaista, with you telling me how you have managed and coped with the pandemic, and also everybody in your organisation?
Thank you, Nickie Aiken, for arranging this discussion today. It is very important, and as you know, this second pandemic, which started a month ago, and the Bangladeshi community, particularly Asian community, or if you say BAME, are very badly affected. And like with the first pandemic, we had very few Bangladeshi died, but this time, if you see, almost every household, people are affected with this pandemic, COVID-19. And we can see on Facebook or social medias, every day people dying, household, 2, 3 people in the same household. Even today I heard a few hours ago, one of my uncle, my wife's uncle died in the Royal Hospital.
I'm so sorry to hear about that, Shaista.
Thank you. And Bangladeshi community is really and vulnerable at this moment. And people are thinking so many things about the vaccine, when they're going to get it and whether they will not get it. Those kind of things happening at the moment.
Okay. Roxy, how have you found coping with the pandemic, and how do you have you been keeping in touch with lots of your friends? How have you been coping?
Yeah, thank you very much for doing this, first of all, because the community is very concerned. As Shasamia said, it's not only Bangladeshis, all Asians and all, particularly if we would say BAME community, all these are very much affected. And there is a sort of factor of fear among themselves, because the first lockdown was just they were getting to know all these things and not. But the second and the third lockdown put them in a very fearful situation, and they are affected. I have heard number of community members, they're calling me about this vaccine and COVID testing and COVID itself. I mean, what is coronavirus and what is happening there? So it's very important to explain them what coronavirus is, and what is important to do, and how to adhere with all the lockdown restrictions, and it's for our benefit. It's very sad to say that many Asians and many BAME communities badly affected as compared to the other ethnicities. And I would say there is an intense need to clarify a few things with the community regarding the lockdown restrictions, how it is important. And it is important for the person, for themselves and for the other family members, and then to the community, and then to the town or city, or all these things. And number two things which I'm now more concerned, that since the vaccine, which is a very good news and very amazing scientific advancement, this vaccine is roll out, and UK being the first #1 in the world, it should be taken with a very welcoming point of view. But I'm listening very sort of mixed sort of comments and views and comments, which is giving me again the need that it is very important, first of all, to all the BAME community to clarify all those myths and views and all those things attached, negative things attached with the vaccine. So when their turn will come, or they should, and on the other hand, few community members are calling when their turn is coming. Yeah. So how they will get the vaccine.
That's a really good idea.
Exactly. So we need to, I think, communicate and get the message across both points.
Yeah.
As a
Brilliant.
parallel, that when the need is there, when they will be
Yeah.
called, how to respond, and
Yeah.
when they get it, what are the benefits to outweigh the very minor side effects.
Great. Mr. Janelle Mohammed, why do you think that people that you speak to and you know are concerned about the vaccine? What is it that's concerning them and making them scared about taking it up?
Hello, hi, yes. Actually, it is it's a mixed sort of views from different people. In my community, one of my aunties, she took her vaccination 2 days ago, and she seems to me fine. There's no side effect or anything. But there is a misconception within our community about the vaccinations. But as far as my aunties are concerned, she's fine. So it seems to me there isn't much concern about it. And I'll request all our community members to, when their times come, to take the vaccinations appropriately, and hope there will be no side effects until it.
And are you communicating as the Westminster Bangladeshi Association? Are you communicating with your members and their families to encourage them to take it up?
Yes, actually, I've done so. I've spoke to my auntie as well. I've explained to her, and she took the vaccination, and she's okay, and she's fine, and she's telling everybody to take the vaccination because it is effective for COVID-19. And also, there is a few bad news on my side. One of my really close friend has died because of COVID-19.
I'm so sorry.
2 days ago, and few of my colleagues and my relatives have died because of COVID-19. And we are really, really concerned. And now, good news is the vaccination is here, and everybody is now, seems to me, recovering from the COVID-19's after effect.
Brilliant. Thank you. Shaista, do you think that there's concern in the community across all ages, or is it affecting a particular age who are worried about taking the COVID-19 vaccine?
I think all ages, in particularly in BAME community. I heard a few days ago, one of my daughter's friend, she is like about 16, and she is like medically unfit, supposed to take the vaccine. She was hard time, but the family refused to do that. So probably so many reasons, particularly BME or in Muslim community. Some people are thinking it probably there is alcohol or animal fat, but this is very minimum part of the people. Most of the people are happy. There's so many myths within the community. Some people think Bill Gates is controlling everything, get a 5G or those kind of things. And this is not only the BME community or Bangladeshi community. I think it's all communities. And what we are doing in Westminster Bangladeshi Welfare Trust, we have different groups and WhatsApp groups, this and that. We have a mosque. We asking the imams, asking people to take the vaccination, which is good and safe for the people.
Yeah, great. Roxy, Roxy, with your medical background, can you send a message to, what is your message to particularly the Muslim community about the vaccine? Because there is it's not led by alcohol. There's no alcohol particularly involved. And I know that people have been concerned about that and about it causes infertility, it changes your DNA. What is your message to people who may be concerned about taking the vaccine?
Thank you, Nickie. This is very, very important, and I'm happy to answer this question. The Muslim community mostly are concerned about I don't know from where they got this idea that there are some pork products in this vaccine. And one is very famous, myth is that it's for the infertility purposes, and alcohol is a little bit because people are aware that in any medicine or vaccine they have alcohol. My message is for all the Muslim community that this vaccine is very, very safe. It is very, very effective, and there is no whatsoever any product of pork, and there is no alcohol, and there is none, I mean, any sort of chip in this. It's very safe. Please have it, because the worrying point, they are saying that, like Mr. Shaista said, that there's a Bill Gates is controlling and there are some chips. So my strong request is, and very, very humble request, being a medical background and working for almost 7-8 years with WHO and CDC in immunization and vaccination, that this is very safe, very effective, and that is the only way to prevent COVID, the virus, and to prevention for all these complications, and to stay safe for themselves, their family, and their community.
Brilliant.
So please,
Thank
whenever their turn comes, please have it.
Thank you. Mohammed, what's your message to anybody who's listening to this from any background, any community? What is your message about the vaccine?
I'll request everybody, when their times come, go to the center, have your vaccination done, be safe, be your community safe, your family safe, your relatives and your nearest relatives are safe. So take the vaccination as your time comes. This is my request to all the communities living in Westminster.
Thank you. And Shaista, have you got anything to say finally to anybody who's listening to this video?
I think I can say one Bangla word if you don't mind.
Of course, speak however you wish.
We said in our Sileti dialogue, Nai mamur se khana mamu is balo, which means something is better than nothing in English. But
no, uncle,
vaccine is safe, and it's particularly for our community. They have to take it. They have to take it. No other way. There is no other way you can escape. So please take the vaccination. We're going to ask Imam again and again to continue their messages to the people to make sure vaccine is safe. Also, I like to mention here, WBWT just opened a food bank in Sherborne House Center. So we'll ask everyone, if anybody wants to donate, please go there. It's open from Tuesday to Thursday, 10:30 to 12 noon to receive the donation. Thank you.
Excellent. Okay, thank you. And Roxy, when your time comes and you are called or you receive your letter to offering you the vaccine, will you take it?
Yes, I will.
Excellent. Sorry.
Because I know that it is very important for me. It's just like a jab flu. If you have it, so get it.
Brilliant. And Mohammed, will you be taking the vaccine when you're offered it? I will
definitely take it once my time comes. Yes, I'll definitely.
Excellent.
And I request everybody to take it.
And Shaista, will you be taking it?
Well, no doubt about it. I'm just eagerly waiting for that.
Great. Well, thank you so much for joining me today. It's been a really good discussion, and I'm so pleased that you are doing everything you can to encourage anybody and everybody to take up the vaccine. I know the programme is rolling out really well in the cities of London and Westminster, and that people are getting called. The over 80s, the programme for the over 80s is nearly finished, and they're now moving on soon to the over 70s. And everything is on track, fingers crossed, to have all 4 of the first categories vaccinated by the middle of February. So thank you once again. Please do take the vaccine. If you are offered it, please accept it, because it's so important that we keep everyone as safe as possible, and that we can start then to move on post this pandemic and start to enjoy our lives again. Thank you.
Thank you, Nickie. Thank you very much.
Thank you.
Thank you.
Thank you very much.
Thank you.